Welcome. Today I will be discussing COVID-19 and the rise of ADHD medications and the correlation between the two. Everybody knows that schooling was heavily impacted by COVID-19. With the spread of the coronavirus, kids were forced to stay indoors and away from others. The generation, which has even been dubbed the COVID generation, lost some of their most important years for learning and social developments. They were hindered due to social distancing limitations. Instead of your ordinary classroom, students and teachers were linked through a computer screen, which led to an even bigger disconnection between the youth and not just the school, but the world as a whole. According to Maria Rogers and Jaden McLean, performing a meta-analysis concluded that a global increase in ADHD symptoms has implications for the prevalence and management of ADHD during post-pandemic recovery. In 2022, when COVID mandates were lifted and in-person school was back in session, there is an influx of kids being diagnosed and prescribed with ADHD and its respective medication. COVID provided a new problem to be considered when analyzing ADHD. ADHD medication includes a series of potentially harmful and addicting drugs, so they should be treated as a last resort means and reserved for only those with more severe cases. There are numerous types of pharmaceutical drugs used to treat ADHD and are broken down into two separate groups, which both have their fair share of side effects, including but not limited to insomnia, anorexia, anxiety, seizures, and agitation. There are non-stimulants, which are medications dealing in non-controlled substances which decrease the chance for abuse. Then there are stimulants, which are controlled substances that increase the risk of abuse and misuse. When paired side by side, you would expect clinicians and patients to opt for medications with less risk. But be that as it may, stimulants are preferred as they are known to work much faster. The two biggest stimulants being amphetamine salts, which are used in brands such as Adderall, Adderall XR, methamphenidines, which are used in drugs such as Concerta and Ritalin.
While ADHD meds are helpful, pharmacotherapy is part of the multimodal therapeutic strategy for ADHD, and it is recommended as the first-line option in the most commonly used guidelines practice parameters, at least for severe cases. Guidelines such as the National Institute for Health and Clinical Excellence, NICE, only recommend a pharmacological treatment for the most severe form of ADHD.
Pharmacies all around the United States struggle to fill prescriptions. The impact of COVID was very apparent and the increase of ADHD diagnosis was significant. Back in October of 2022, the FDA released a notice.
Other manufacturers continue to produce amphetamine mixed salts, but there is not sufficient supply to continue to meet U.S. market demand through those producers.
There's a very dramatic imbalance between the supply and demand of ADHD-based medications, and the market simply cannot keep up. The FDA has even approved a new drug in 2023 to be used to treat ADHD. But already, as of 2023, there are shortages on the new substance. It seems that America has developed a fixation on ADHD meds, and the problem will only continue to grow if diagnosis and prescriptions remain on the same influx upward in the years to come. ADHD diagnosis and overprescription of medications has risen in the past decade and increased during COVID-19. Respectfully, mishaps such as the ongoing drug shortage have been linked to the drastic rise in diagnosis of the disorder. While there is a possibility that this can be true, it is no excuse for the reason harmful stimulant drugs are being prescribed so commonly while there are safer alternatives and treatment available. The imbalance of supply and demand for the drug pushes the notion that our nation's culture opts for quick solutions and is impatient for timely mannered and effective therapy. COVID-19 changed the world in many different and impactful ways. We were hindered by the limitations placed on us by social distancing mandates, and we are now seeing the consequences unfold. It is important that we seek the help we need for our physical and mental needs. There are many different ways that we can do so. However, it is also important that we seek the knowledge and information to find the most beneficial solutions to our problems. ADHD medication is there to help those who need it. As much as it can help, it can also harm. At the end of the day, there are still dangerous addicting drugs. The use and abuse and overall reliance of these drugs, displayed in the last few years, can further help us understand the bigger problems of America and its culture, highlighting factors such as occupational and educational pressures placed by society, the state of our medical resources and how we access them, and the overall importance of human mental health. ADHD medications have long-term lasting effects on individuals. Instead of hastily opting for the drug, individuals should approach the disorder with informed decision-making and careful monitoring of a diagnosis. Your health is critical.